and welcome to Saboor Healthcare Insights. My name is Dr. Saboor Shahzad, and today's video is about budgeting in healthcare systems. In today's discussion, we'll first define what budgeting is and understand its importance. Then we'll identify some prerequisites for the budgeting process. We'll go through types of budgeting, and finally, we'll list the steps in the budgeting process. Any references used for this discussion will be pointed out at the end of this video. If this is your first time visiting the channel, let me point out that this channel is dedicated to learning and gaining insights within healthcare. If you feel this channel can help you and others, please hit the like button and hit the bell icon to subscribe. This helps in both promoting the channel and keeping yourself up to date when new videos are uploaded. Now, without further ado, let's get into this topic of budgeting. If you're either working in a healthcare setting or just learning about it, then you may know that the current landscape of healthcare involves planning for future patient volumes with less and less reimbursements per case. This makes cost-cutting or cost controlling extremely important, along with decreasing waste in the system. A 2011 research report by Institute of Medicine categorized 6 domains of waste where healthcare spending could be improved and accounts for about 34% of the waste. These include failure of care delivery, failure of care coordination, overtreatment of low-value care, pricing failure, fraud and abuse, and administrative complexity. Many healthcare organizations are currently working together to reduce this waste in their organizations, and many have aspirational goal of about 50% reduction. Now you understand why it is so important for managers in the healthcare industry to develop specific financial skills and understand how budgeting should be done to be effective. In short, managers must learn how to budget and make the budget both realistically and successfully. Let's first define what budgeting is. We all have a basic idea of budgeting as planning expenses with generating or to be generated income. However, budgeting in healthcare is more than just numbers. It's a strategic process that is crucial for financial health and success. It involves planning expenses, forecasting income, and turning operational plans into financial reality. Sequentially, budgeting comes after operational planning. For those of you who are wondering what an operational plan is, simply put, an operational plan is taking your long-range strategic plan and translating into goals to achieve throughout the year with specific actions. We'll cover these as strategic planning, financial planning, operational planning, etc., hopefully in our next future videos in detail. For now, let's stick to budgeting. So budgeting not only creates an opportunity for managers to exert control, but also has become a control standard against which leaders can objectively measure the performance of the organization and the managers. Next, I want to talk to you about prerequisites to budgeting. Now, before an effective budget could be planned and solidified, there are some prerequisites for the organizations. First, the organization must have a clear management accountability that goes with the organizational structure and a well-defined chart of accounts that correspond to this organizational structure. There should be accounting systems in place that are both prompt and accurate and ensure financial accountability and responsibility. There should also be a budgeting point person to coordinate the whole budgeting process, and this person should also serve as the chair of the budgeting committee. The budgeting committee should put out a budget calendar and a manual to assist department managers in developing their departmental budget. In this budgeting manual, there should also be some necessary strategic planning information, the chart of accounts, list of committee members who are available to assist for specific segments, some anticipation or assumptions about growth, inflation, salary information with raises, and important completion dates, and along with, of course, a clear organizational structure. Another prerequisite is to have a complete management information system that captures non-financial information of each department. And last but not least, one should also have the prior year's data regarding expenses, volumes, and revenues to accurately plan and forecast. Let's move into different types of budgets. For types of budgets, you can classify by management approach and by design characteristics. Well, what does management approach mean? Management approach basically means either a top-down budgeting approach or a bottom-up budgeting approach. Of course, there are advantages and disadvantages to each of these. As the name suggests, the top-down budgeting approach is where senior management plans and develops the budget with little to no input from the managers of each department. Now, why might this be desirable? Let's look at it this way. In many organizations, it is the senior management who has the best vision and information available, which makes them uniquely positioned to objectively view the future, and handing the budget down this way creates alignment with strategic plans. However, as you may guess, it is difficult to implement, especially if department heads or middle managers don't have any input in it. On the other hand, the bottom-up budgeting, where subordinates develop the budget or provide detailed input, the advantage is clearly the commitment to the budget, but the downside here is that subordinates may not be in the best position to have the best future vision or may not even have all the information needed to have that vision. The other approach is design characteristics, which means characteristics of the planning are applied to budgeting. Now, in these design types, the first is incremental versus zero-based budgeting. Let's dissect these two. Incremental budgeting simply means you only budget for what will be new or changed, such as new programs, new equipment, new positions, etc. The underlying assumption for incremental budgeting is that all current equipment, positions, and operations are needed for the continued operations of the organization, and all are working at a peak performance. This doesn't sound realistic for every scenario. So why do organizations take this approach? Well, the simple answer lies in its ease. Additionally, it requires minimal time commitment to prepare this type of budget and may even support the culture of large organizations. But as you can easily point out, the biggest disadvantage is the assumption that all current operations are essential, which most likely is not true, especially in the healthcare environment. The exact opposite of this is zero-based budgeting. And yes, you guessed it right, it assumes no underlying need for anything. In other words, you have to justify every existing position, program, equipment, along with every new one. And this is exactly why it's advantageous, as it is an extremely conservative approach. This may even help, at least for a short period, as the healthcare environment has been rapidly changing along with reimbursements and have been moving towards all prospective payments per patient case versus historical fee-for-service payment approaches. No doubt there are many disadvantages to this approach, with time commitment being the biggest one. Besides time commitment, this approach also creates a much more administrative burden for managers, along with extreme communication requirements and much fear and anxiety among the employees. Next up is the comprehensive versus limited in scope budgeting. So another approach is comprehensive budgeting, where it is just simply integrating all budgets into one document. This could be beneficial for all to see, as it is recognized that capital affects operations. Limited scope budgeting, on the other hand, parses and segregates the budgets. It is true that most organizations like to integrate the budget at the executive management level only, but this creates a question as to at what level should budget really be integrated. For example, many organizations choose not to show revenue information to department managers, as they believe department managers don't understand the difference between billed versus collected revenue. It may also be because many revenue-generating departments in healthcare are used to cover expenses for departments that do not generate revenue. The non-revenue-generating departments in a hospital include HR, IT, finance, etc. Another reason may be because department managers cannot really affect changes in revenue, which is a function of volume orders by the physician multiplied by the rate set, typically by a CFO. A similar case can also be made about whether managers should be shown indirect expenses. Another classification of budgeting is based on whether budgets are fixed or flexible. As it sounds, fixed budgets have underlying assumptions that volumes and the related revenues, along with variable expenses, remain constant throughout the year. Although they are easy to project, fixed budgets are really unrealistic for healthcare organizations. This is because no healthcare organization has fixed volumes, and both volumes and associated variable expenses fluctuate throughout the year, which in fact account for almost half of the organization's operating expenses. Flexible budgets, in comparison, are more realistic for healthcare organizations rather. They consider all fluctuations in volume based on historical and, at least within ranges, express the probabilities of variation and have room to adjust variable expenses accordingly. Now, after that, you want to probably dissect a little bit about discrete versus continuous budgets, and you might have heard these terms before, but what are discrete budgets? These apply to a fixed time period, typically a year in any healthcare organizations. As the new year begins, so does the new budget. Although discrete budgets are relatively easy to prepare, budgeting in a 12-month increment poses some difficulty due to often changing circumstances. Another difficulty could be for managers who see discrete budgets as if they spend less than the budgeted amount and display more efficiency. This can hurt them next year, as they will get a smaller budget amount in the following year. On the other hand, continuous budgets are really continuous, and the year never occurs, and they're continuously rolling. This is why they're also called rolling budgets. For continuous budgets, wise managers quote unquote roll over their efforts to the next month. As far as the steps in budgeting process go, these involve projection of volumes, conversion of volumes into revenues, conversion of volumes into expenses as needed, with, of course, evaluation afterwards. Since this video is already too long, I'll be covering these steps in greater detail in the second video on budgeting. Please look for budgeting video number 2 for gaining detailed understanding of these steps. Again, thank you for joining me and staying here throughout the video. If you have any questions or comments, feel free to put them under comments and I will try to do my best to answer and engage with them. I hope to see you again soon with my second video on this topic, Budgeting in Healthcare System Part 2. Until then, take care and keep learning. Thank you.